morning, everyone. This is Michelle Hughes from Ageless and Timeless. And as always, I have an incredible guest today. Her name is Dr. Yvonne Karney, and she started out as an OBGYN, and now she's segued into functional integrative medicine, still focusing primarily on women's health. Correct, Yvonne?
Yes.
Okay,
Primarily.
So my question is, how did you make that journey from being a specialist in gynecology to being a broader-based functional medicine doctor?
You know, it's a special relationship that women have with their OBGYN. And so I would frequently hear these cries for help from women about it. And it would always come kind of at the end of the visit. You know, they'd come in, we'd do their visit, and then towards the end they'd be, you know, my regular doctor says everything's okay, but I don't feel good. So it's got to be my hormones, right? That's the last ditch effort, is that help me, it's my hormones because all my labs are normal.
Right.
And I, after I heard that so many times, it made me realize, you know, these women weren't crazy. They weren't lying to me. They weren't making it up. And I realized we were missing something big. We were missing something big, and I didn't have the tools in my toolbox to help them. And so it really opened my mind, and I was a dyed-in-the-wool OBGYN, ACOG knows best. I could quote all the studies. It took a lot for me to realize that I didn't have the right tools. And then I started living it myself, where I was losing control over my emotions, and things that rolled off me one day made me furious the next. And I was like, oh, this is what people are talking about. These mood swings, and then forgetfulness, and this fatigue. And that's when I really dove into functional medicine, saying, you know, all because my labs were normal too. And it made me realize that normal is not the standard. And they don't test enough, and they don't look at the labs with the right lens. You have to use optimum and not normal. So all of those things made me realize that I couldn't help women with the tools I was given. So I had to learn new tools. And then about 10 years ago, I left my regular practice and started my own functional medicine practice.
So did you have to go back to school to get more training? Where did you go, and how did you do it?
There's a lot of resources, and I used many. So initially I went to a bioidentical hormone symposium, and I was so embarrassed at the time because I didn't know the difference between bioidentical or not, because they don't teach you in regular OBGYN training. We were just told hormones are hormones and doesn't really matter, just give them. And so I went to a bioidentical hormone symposium, and that weekend they were talking about, you know, hormones, but then they started talking about adrenal and thyroid and inflammation and gut. And I'm like, wow, I need to really dive in. So I did a fellowship through A4M, the American Academy.
I knew you were going to say that.
And there's other ways that people can get their training. It's really just a paradigm shift. You know, instead of just using algorithms, you're really shifting into the why behind. And so that paradigm shift is where the extra training came in.
But Yvonne, you know, the truth is that most the women going to allopathic medical doctors do not really get their hormones checked. I mean, those doctors, many of them never even ask about hormone health. They do the regular CBC and all the, you know, typical cardiac lipid profiles and all, but they don't look at what is the superhighway of our bodies, which is, and that's men and women. You know, we tend to focus on women with postmenopausal or let's say, you know, around 50 years old. But the truth is that men are going through similar situations, and they're never addressed. So it's good that, you know, people like you exist, and that women find you. That's the key, that they find those doctors that are much more aware. So what is it about HRT that makes it so important? I mean, just give us a kind of a quick synopsis of why and when I say HRT, I really mean bioidentical, BHRT.
Yes.
So why is it so important, and why is it really critical not to do HRT versus BHRT?
And I hope that this becomes more talked about. It finally is, because the way the FDA finally lifted the black box warning on hormone replacement therapy. So,
right.
But we're talking 23 years of women going into menopause and being told that they shouldn't take hormones because they're dangerous.
I know.
But now finally, with that being lifted, hopefully the word will get out there. But then you get into people that start prescribing hormones that maybe don't know the intricacies of it and the difference between bioidentical and regular. But back to your question, hormones are messengers, and they tell your body what to do. And the three key hormones for women that can decline in menopause, two of them for sure decline, and one of them very frequently declines, are estrogen, which is actually not truly a hormone. Those three different hormones that we call estrogen, but estradiol is the real hormone that gives us the most benefit. So estradiol, progesterone, and then possibly testosterone.
Correct.
And those hormones are important for brain health. They're important for mood stabilization, for sleep, and those are very key components to our longevity. People think that it's just hot flashes and those go away after 5 years, so suck it up, buttercup. But it's way more than that. It's not just vanity either, but hormones are good for your skin. Estrogen's very good for your skin, and so women who have low estrogen, they're going to wrinkle faster. Hormones are good for your pelvic health. So if you're in a relationship and you want to be able to maintain intimacy, estrogen is very important for appropriate vaginal elasticity and moisture and the ability to maintain sexual relations. And the health of the tissues down there declines with low hormones. Women get more bladder infections, they start having pain with relations, eventually they start to avoid it. And then it's the brain issue. So women who take hormone replacement therapy have a much lower incidence of dementia than women who don't. And you tell me when you don't need your brain anymore. I'll tell you when you can, get off your hormones. So there's so many benefits that we know now that is much more than just hot flashes. But the key is to use the hormones that are the same structure that your body used to make.
Yeah, let's dive into that. That was exactly what I was about to ask you. Is to differentiate between the traditional hormones, which are Premarin and et cetera, and the bioidentical, which you're just talking about. So tell us what that is. Give us a little tutorial on that.
Thank you. Yes. The term bioidentical is made up. So we in integrative medicine made up the term, but we made it up for a reason. And it means that at the molecular level, when carbon and hydrogen and oxygen join together to form a structure, at that level, it has the same exact structure as what your ovaries used to make. So hormones are the keys, and the hormone receptor is the lock, and it has to fit on the receptor exactly. And if you have a key that's a slightly different shape, it may trigger that lock, but it can also trigger a different lock. The lock of inflammation or increased breast cancer risk. And we don't want those things. We want the keys that are available that our body has made for decades. And if it's available like that, it only makes sense to use it. And there's some regular doctors poo-poo the term bioidentical, and they say we made it up, but then they'll use terms like isomolecular, which is exactly what bioidentical means, or body identical, which is exactly what bioidentical means. It means at that level of biochemical molecular structure, it's exactly the same as what your ovaries used to make. Some people mistakenly use the term natural versus synthetic. They mean well, but that's not the right term, because natural just means it comes from nature. And there's a lot of things that come from nature that are not bioidentical to humans. You mentioned Premarin. Premarin is natural. It comes from horse urine. So that's natural. And the way Premarin got its name was pregnant mare's urine, Premarin.
Right.
And that's very natural, but it's not bioidentical unless you're a horse. So if we can take the hormone that is exactly like our ovaries used to make, it's going to give us the benefits that we've had throughout our life and minimize the risks, because when our body is used to it and it's the same structure, we metabolize it better and it doesn't trigger abnormal responses that can be some of the risks that go along with the other type of hormones.
Cellular protection is a key component of longevity, and that's where C60 enters the conversation. Known for its powerful antioxidant properties, C60 is being explored for its role in reducing oxidative stress and supporting cellular resilience. As interest grows around mitochondrial health and aging at the cellular level, C60 continues to stand out as a fascinating area of research and application. It's exactly the kind of forward-looking wellness solution we aim to spotlight on Ageless and Timeless. For more information on C60 and how it's being used in longevity-focused routines, check the affiliate link in the show notes or use Ageless10 for 10% off your purchase of all their products. So Yvonne, what's the source of a bioidentical hormone? I mean, obviously, the women who take them know that it's yams are one of the big, but what give us a little more info on how it is defined as bioidentical. What's inside?
Well, it doesn't, that's a great question, and it's often a confusion. It doesn't really matter where it comes from. So yes, you can get it from yams. I don't care if it comes from a yam or a lab, as long as at the molecular level it's estradiol. It's not ethinyl estradiol or or medroxyprogesterone acetate is a progestin one, or those things don't matter. The question of when it's made in the lab has to do with, are there other ingredients in it? Are there solvents? Are there residues? Are there chemicals in it that are harmful to us in addition to the hormone?
Right.
But if it's at the molecular level the same, I don't care if it comes from a plant or a lab. It's really using the pure terminology and making sure that it has nothing harmful in it. It has only the good bioidentical hormone, nothing else, and it's delivered in a manner that your body knows how to accept safely.
And then the compounding pharmacies are typically where people like you go. So how do you know which compounding pharmacy is the most efficacious and then pick that for your resource for your patients?
Well, thank you for asking that. And I also do want to bring up that you can get bioidentical hormones from regular pharmacies. And
yes, that's true.
And so I often will start there because it's economically feasible. It's a little bit less expensive. So the key is, for estradiol, don't take oral estrogen. You need it in a transdermal form, either in a cream or a patch, because if you take even bioidentical estradiol, if you take it in pill form, it gets digested. So it gets changed by your liver during digestion, and it increases inflammation, and that increases the risk of heart attack and stroke. So for all those years when we were told, when we were taking birth control pills, that birth control pills have a risk of heart attack and stroke, it's because it's oral estrogen.
That's right.
And so if you use transdermal estrogen, you bypass the liver, and it does not have that increased risk of heart attack and stroke. And so the patch is a very good starting point. The only issue is it only has 4 doses. So I'll typically use one of the patches, and then we'll do studies to see if their levels are optimum. And if they're not, and we can't find that sweet spot with a patch, then we move over to cream.
But what about troches, sublingual or injections of the estradiol?
Injections have, like, intramuscular injections or subcutaneous injections, it's really hard to
Right.
get a steady state. You're going to get fluctuations, which
Right.
make it hard. Pellets you can use. Those are absorbed over time slowly, and they last somewhere between, the estradiol pellets typically go away within 3 months, whereas testosterone pellets last 5 to 6 months. The issue with estradiol pellets is that I don't recommend those for women if they still have a uterus, if they have all their female parts, because we really need to be careful with the balance of estradiol and progesterone. And if you're
Right.
imbalanced, then you can trigger some endometrial lining growth, some
Yeah.
uterine lining growth, and get some postmenopausal bleeding. And once that pellet's in, it's in. You can't remove it. If someone's using a cream and they have some symptoms, you can stop the cream and the symptoms will go away because the estrogen
Right.
levels don't stay high. But with a pellet, once it's in, it's in. So I'll use testosterone pellets for women once I know they're tolerating testosterone, and I'll occasionally use estradiol and testosterone pellets together for a woman who's had a hysterectomy. But then you get into the issue that the testosterone lasts 6 months, the estrogen only lasts 3, so then we go to a patch to make up the last 3 months until they need another pellet.
It's a little complicated.
It's complicated. You need to work with
Yeah.
someone who knows the finesses of how to do it and
Right.
evaluate the testing and evaluate your symptoms.
Yes, but I'm so happy that you mentioned the balance of progesterone and estrogen, or estradiol, because I hear so many women who are saying, "Oh, I'm on estrogen replacement therapy, but I don't take any progesterone." And I always say to them, "Do not do that.
Do not do that.
You know, you need the balance of what." Explain that a little further. Go deeper with that, so people understand why it's so important.
Yes, thank you. I'm going to break that up into 2 parts. The first part is for a woman who still has all her female parts, so she's never had a hysterectomy. It is absolutely crucial if you still have a uterus that you need progesterone and estrogen, because estrogen alone, it stimulates the uterus just a little bit, and it's a little excitatory, and so we need the progesterone to keep that calm. We know from studies back in the 70s that unopposed estrogen over time leads to endometrial hyperplasia and endometrial cancer. And so that's how we learned way back in the 70s, don't give estrogen alone, because 17% of those women went on to develop endometrial hyperplasia and cancer. And then we learned, well, if you give them the progesterone with it, then it prevents that. So it's mandatory for people who still have a uterus. Here's where OBGYNs frequently, I think now, get it wrong, is that they're like, oh, you've had a hysterectomy, you don't need progesterone anymore, we can give you estrogen alone. Sure, there's no uterus to get unopposed estrogen, but progesterone is so calming. It has, this is the one that I will use oral. It's the only one. I don't use testosterone or estrogen oral, but progesterone oral is fabulous because as it gets metabolized, it turns into a neurotransmitter-like substance called that mimics GABA. And GABA is a very calming neurotransmitter. And so many women in their 50s and beyond struggle with sleep. And so it's wonderful to give them that progesterone, which is calming to the nervous system and can help them relax and sleep in the evenings. And so I will frequently use oral progesterone in my menopausal women.
Yeah, and take it at night, of course, much better. And about 100 milligram capsule, is that about what?
That's the one we know for sure prevents endometrial hyperplasia. We will follow the levels with urine hormones, and some women, 100 milligrams too much. And so and then in that case, we'll use bioidentical we'll use compounded progesterone, because the progesterone from the regular pharmacy only comes in 100 or 200 milligrams. And we know that 100 milligrams for sure protects the uterus. I think lower doses will too. There's just not a lot of studies to prove it. So we just follow these women very closely if they're on a lower dose than 100, because they don't tolerate the higher dose.
So now on the cream, because there are so many on Amazon, one day I was kind of looking at their offerings because I thought, in case I run out of my estrogen, and I don't the form that I take it in, the estradiol, and I don't get the pharmacy doesn't fulfill the prescription in soon enough, I better have a backup. So I bought some estrogen cream, but then I thought, am I really getting the right? Well, how do I know it's not coming from China? And
right.
It does.
What are the
it
other
doesn't
ingredients?
Exactly.
Is it third party tested to verify? That's that's a little risky. It makes me nervous.
That's right. That's
hormones are powerful, and so we need to honor them. We want to use them for their benefits, but honor them and not overdose on them.
That's right.
And we need to know, that it's been studied. Compounding pharmacies are very rigorous in the studies that they do, where they verify that this amount of cream contains this much estradiol, and if they even put it in a meter dose container, or they give you a syringe where you can measure it down to the 10th of a milliliter that you're rubbing on your skin. But those other creams, we just don't know. I don't think they're studied enough, and I would not recommend using those for estradiol. Yeah. Progesterone's a little different, because progesterone, it's almost impossible to harm yourself with progesterone. And so there are some over-the-counter progesterone creams, and it's a great big bullseye for progesterone. It's much bigger, and your body tolerates a much wider range of progesterone than estradiol. So I don't have a hard time with women using an over-the-counter progesterone cream, but if they're on estradiol, I wouldn't use an over-the-counter progesterone cream if they're on estradiol, because we need to know that they're getting the balance levels.
That's right.
And then,
so this is really important information that we're talking about, because it's all about balance, as you said, and the right dosing, and it's customized to the individual. Some people, like you said, some people could take less than 100 milligrams of progesterone and still feel great, but others really, need that 100, or as you said, it can even go higher.
Yeah.
So with estrogen, there are three different ones, as you said. So the estradiol is the one we've been talking about. That's the most common and the most important. What about the other estriol and estrone?
Yeah, so estriol is most common in pregnancy, because it's made out of estradiol by the placenta. So women in pregnancy will have higher levels of estriol. There are different schools of thought amongst integrative doctors as far as what is the best estrogen mix to give to women. Yeah. Estrone is not a lot made in the ovaries. It's mostly from peripheral conversion of testosterone to estrogen, and it's done in the fat cells. So,
is estrone the one that you could be least concerned about? But you should like I always used to get E1 and E2, and I thought E1 and E2 was estradiol and estriol, and then E3 is the estrone, which you really don't need to be concerned about.
Estrone is E1.
Oh,
estrone is E1. Estradiol is E2, and estriol is E3. And so
good. I'm glad you're correcting myself.
There's no reason to give estrone to someone. None. Zero. It doesn't give you the benefits. It's not. It doesn't help the brain. It's converted from testosterone by fat cells to estrone. That's how it's made. The question is, should you use estradiol alone or estriol with estradiol?
Right.
And
which is
some
called
women will use estriol alone vaginally, because there's not a lot of estriol receptors to give you the benefit of estrogen replacement therapy, but there is in the vaginal tissue. So for women who, for some reason, are afraid of hormone replacement therapy, or they don't want to take systemic hormone replacement therapy, we can get a lot of pelvic floor vaginal health benefits using a compounded estriol cream alone. But for systemic hormone replacement therapy, this is where there's a difference of opinion. Some people use a blend of 50-50 E2 and E3. Some people use a blend of, it's called 80-20, 80% E3, 20% E2. And then other people will use estradiol alone. I use estradiol alone because I used to use the blend when I first started, but as I was thinking about this, women only have significant amounts of estriol during pregnancy. And so in my mind, I'm like, why do we want a menopausal woman to be having estriol levels like she did when she was pregnant? The benefits to the brain, the bone, the colon, the skin, we can get from estradiol. And so that's what I use now. I just use the estradiol alone, and I'll use estriol just topically, vaginally for women who are concerned about taking estradiol.
So that's really important information. So the thing for women who are listening to right now to this podcast, the biased, which is the 2 and 3, the estradiol and the estriol, estriol. So that's called biased. So if your doctor says, I'm going to give you a prescription for biased, you know now that that's what it is. But that Yvonne is saying you really don't need the estriol unless you're pregnant, but you're making it, your body's making it itself, so you actually don't need it. But I thought, for me, my functional medicine doctor gave me biased, but then I also use the syringe, and I'm postmenopausal, so I also use the syringe for the vaginal tissue area, like you said, for lubrication. So is that, in your opinion, is that putting too much if you're using bias and the syringe? And the syringe you only use when you're, having intimacy, so you don't really need to use it every day, although they say on the bottle 3 times a week, just to keep the lubrication of the vaginal tissue. So what are your thoughts about that, about using bias plus the syringe?
It depends, because when we're using biased, it's from a compounding pharmacy, so the concentration is unlimited from very low concentration to very high concentration. So as long as someone with knowledge is monitoring your levels, if you get the benefit, because it could be cost effective to say, I'm going to use most of it on my arms and inner thighs because that's where it's absorbed well, but I'm going to use a smidge, just a little bit down there at bedtime. Typically 1 to 2 to 3 times a week is all you need to target that area, because it increases elasticity, moisture, collagen of the vagina. That's fine, as long as you're monitoring your levels. Maybe you don't need as much on your arms then, right? So that's where the monitoring comes in.
Okay, I didn't realize you could put it on your arms and or other parts of the body. I thought it was just vaginal only. So that's interesting. Does it help with crepey skin if you put estriol?
There's a huge uptick right now in estradiol creams because it does help with skin.
But so it's estradiol, not estriol. Okay, good. So is there a just your opinion, is there a cream, a manufacturer of a cream that is safe for women to ask their doctors to prescribe?
Not without a compounding pharmacy, unfortunately. It breaks my heart. But the regular Estrace is the cream. It has parabens in it. And parabens are not good.
Terrible.
They're toxic.
Exactly.
They're in a lot of creams because it makes them emulsify and absorb easier. But that's where I was talking about. I don't care if it's from a compounding or traditional pharmacy, unless there's something that the traditional pharmacy's putting in it that we don't need, like food coloring. Why do you need food coloring in your capsules? They don't have to look like M&Ms. It's a medicine.
Right.
So if there's food coloring in it, that's a toxin. We don't need that. If there's perfume in it, that's a toxin. We don't need that. If there's parabens in it, that's a toxin. We don't need that. So the advantage of the compounding pharmacy is you can write and know that they're not putting those extraneous ingredients in it, so that there's nothing harmful in it at all.
So let's jump over to testosterone. That's kind of the big T, is kind of the big controversy in hormone. So what are your thoughts? Why are so many women thinking, oh, I don't need testosterone, and that's only for men, and even the doctors tell them you don't need it, but yet it's so important. So what are your opinions about TRT and testosterone replacement therapy, and how to the best method for assimilation?
Well, this is gaining traction, so I'm very excited about that. I think with people becoming more vocal, and some celebrities now that are talking about their menopause journey so that people aren't afraid to talk, it's finally becoming something that people are talking about. Here's a few facts. Your ovaries made 2 to 3 times as much testosterone as estrogen. And so just because we have 1/10 the amount of testosterone as a man, but it's so important for us. And it's the highest sex steroid by concentration in our body, more than estradiol. It's important for mood, decision, brain, muscle, bone, so many things.
Libido.
Yeah, absolutely.
Don't forget that.
The problem is nobody knows what optimal levels are. The lab studies that look at normal range for testosterone, there's many problems with that. One of the problems is that the levels in women are so low. We're talking nanograms per deciliter, which is a tiny, tiny concentration. And when you're checking a level in a man, if you're trying to use the same machinery and methodology, because women have 10 times less, you're looking at the edges of detection. So we've had to develop better equipment to be able to even know with precision what a woman's testosterone levels are. Because there's as you get lower and lower concentration, it's harder to distinguish the value. But the other issue is no studies have really been done. They've looked at women, and they typically put them in like a scattergram, and they say of these 400 women that were still, one of the criteria for determining who was normal for testosterone was they were cycling. So if you were a woman that had regular periods, they checked your testosterone level, and then they platted all these 400 and something women out on a scattergram, and they figured out that this particular range was where most of them, had. Well, testosterone has nothing to do with your menstrual cycle. So just because you're cycling doesn't mean that you have optimal testosterone levels. So when we look at what is the reference range from traditional labs, I think that it's artificially low. And I know this because 10 years ago, one of the very well-respected labs in the country, their normal range for testosterone included 0. So the range for testosterone for free testosterone was 0 to 6. And I even called the lab and I was like, seriously, 0? You don't think you need any testosterone if you're a woman?
Yeah.
Because if it goes down to 0, there's no such thing as low testosterone, because you can't have less than 0.
Right.
And so now they changed the reference range to 0.1.
Oh my goodness.
And so,
oh my gosh.
That's the question, is like, the conundrum is that we want to find where women feel the best, but they're not having hyperandrogen effects. Because we don't need to be, the only right now FDA approved use of testosterone in women is for transgender women who want to transition to men. And so they give a man's dose testosterone. Well, if I were to give you a man's dose of testosterone and you didn't want to transition, you'd feel really good for about a month. Really good. You'd have energy and libido, and brain function, and you'd be like, wow, where's this been all my life? But then within a month or so, you start to get the hyperandrogenic effects. You get chin hairs that are too thick. You start losing, you have a male pattern, balding on your head, more whiskers. And then the big one is you can have clitoral enlargement. And that doesn't necessarily go away when you go back down on the dose. So we have to find a good women's dose of testosterone. And right now, the only way to get that is from a compounding pharmacy, either in a cream or a pellet, or to use teeny tiny injections. But again, the injections are a little bit riskier because they get absorbed quicker. So you have these highs and lows, as opposed to a cream, you're going to get more of a steady state. And the pellet, you get a little bit of a bolus, meaning a high level, but it comes down pretty good to that lower, the average range. It's not absorbed quickly like an intramuscular injection. And there are women right now whose gynecologist is giving them testosterone in the form of the man's testosterone gel and say, well, just take a quarter of a pump or take a tenth of a pump. It's like, how can you take a tenth? You're pressing the pump down and you're trying to stop 1/10 of the way down. That's not measurable. That's dangerous because that's 10 times the dose that you need.
Well, not only that, but when people test their labs on testosterone, a lot of these doctors don't even understand you need to do free testosterone and the other testosterone that are same. It's the same like the thyroid. Yeah. Very often they only do TSH, which is really not a thyroid; it's a pituitary. So talk about that for a moment. How to know from your labs whether or not you are getting enough testosterone.
That's a loaded question. There's a lot of different opinions on this. So I'm going to give you mine, which of course I think is right, because otherwise I wouldn't be operating that way.
Well, that's why I asked it.
I will check a serum testosterone on a woman if they have a pellet or if they're not on any testosterone at all. And I think it's reliable. If someone is on a testosterone cream, I do not check a serum testosterone level because I just don't think that it gives an adequate level of the body burden. When we check a serum level, we're checking a venous blood flow. And we're assuming that what's happening in the bloodstream of the vein is what is going into the body. But these hormones are fat soluble. They're made out of cholesterol. We now think that they're transported mostly through the lymph system, which transports fat soluble things much more than the bloodstream does. And so I'm not convinced that a venipuncture sample is going to give me a good level of a cream being absorbed through the skin and transported through the body and the lymph. So for women who are on a cream, I will either use salivary or urine.
Oh, okay.
Because I've seen testosterone levels in the blood be low when they're on a pretty good dose of testosterone, and then I've gone back and checked salivary or urine, and those levels are high.
Oh, wow, that's important to know. So, when a woman comes to you and says, all my hormones are normal, according to the results that she's gotten, but I don't feel well, what's the first thing that you do as the physician? What's the first thing that you check to try to be a detective about why am I not feeling well and yet I'm getting these results that are allegedly normal?
Well, this is my passion, and so I call myself the Hormone Locksmith. Okay, because hormones need receptors.
Right.
And we need keys. The hormones are the keys, but we need healthy locks also.
Right.
So if you have beautiful keys and rusty locks, what happens? The door doesn't open. And there's so many people, and I'm glad that hormones are getting attention, and they're very important, but we cannot forget the locks. We cannot forget cellular health, receptor health, cell membrane health. And that's the issue that a lot of bioidentical hormone doctors might miss. They keep giving more and more hormones because the woman has hormone deficiency symptoms, even though her levels might actually be good. If they don't feel good and their levels are normal, the first thing I do is I'm like, well, what are they calling normal? Are they checking them right? And is it optimal? But then if their levels are optimal, I'm like, okay, then something else is causing this. Maybe you're maybe you have rusty locks. Do you have environmental toxic exposures? Do you have gut inflammation? Do you have super high stress? Do you have micronutrient deficiencies? Because if you don't have the right micronutrients, then your body can't respond to the hormones. Do you have hypothyroidism? Because if you don't have energy to respond to the hormones, then you can't make the stuff that the hormones is telling your body to make. So it's the whole, you have to do the whole person.
You know, this is why functional medicine is becoming such in huge demand, because you know, doctors like you are looking at the whole body, and they're looking at the source, not just the symptoms. So they're looking at the root cause and trying to get to, you know, understand that, rather than just giving you a pill to address a symptom, which then causes more side effects from that, you know, that particular chemical, that pill. So, all right, I'm glad you mentioned the thyroid, because that's another kind of big black hole. One, because the measuring of the thyroid, as I mentioned earlier, is so inadequate. And two, you know, it's the most underdiagnosed condition, I think, in our health. So talk to us about, you know, how to manage your thyroid properly.
Thyroid hormone is like our body's thermostat. So it really sets our metabolism. It's absolutely necessary to make energy. It's what helps to shuttle things into the internal battery called the mitochondria, which make energy inside of our cells. And so we absolutely need thyroid hormone. Thyroid is a gland in your neck that makes a pre-hormone called T4, but your body needs a different hormone called T3, and that gets converted elsewhere in the body. And the hormone that traditional medicine doctors have been trained to check is TSH, which, as you already said, is a pituitary hormone. It's thyroid stimulating hormone. It's not thyroid hormone. So the assumption is that if your TSH is normal, and the problem with that is there's a 20-fold range that's called normal range for TSH. It goes from 0.5 to, you know, 4 point something. I mean, it's a huge range. And that's problem number one. Problem number two is it's not necessarily indicative of your body's thyroid hormone balance. If your brain has too much stress or has been damaged by environmental toxic exposures, and the pituitary gets knocked out by these massive environmental toxic exposures, then the brain doesn't supervise the body very well. So you could have low thyroid hormone and a normal TSH. So you cannot use TSH as the proxy all the time. In some people it works, but in others it doesn't. So at a minimum, you need to check TSH, free T4, and free T3. Very few traditional doctors actually check free T3. And I add reverse T3 in there also, because reverse T3 is what T4 can become, either T3 or reverse T3, and they're not the same. T3
so what is
stimulates the receptor, reverse T3 blocks the receptor. I tell people this, look at your two hands. They have the same ingredients. They each have 4 fingers and a thumb. That's like T3 and reverse T3. But they're not interchangeable because the thumb's in a different place. And so the hormone...
That's a very good metaphor, actually.
The hormone receptor is a right-handed glove. And T3 is your right hand. It fits perfectly into the right-handed glove. But reverse T3 is your left hand. And how does that fit into a right-handed glove? It doesn't. And so
I'm so glad that you're... Oh, go ahead. Finish what you're saying.
If you don't check that, then you could think that someone's doing fine because their T4 is okay, but biochemically, they're hypothyroid because they're making the blocker instead of the one that actually triggers the response.
Yeah, I think people can just understand that T4 is like your reserve tank. If you were thinking analogous to your car, it's like you have a reserve tank, but if you're not converting back into the actual gas tank of T3, which is T3, then you're not getting the use of the thyroid hormone. It's just sitting, it's kind of like dormant, right? So yeah, and then the other issue is what you said, that so many doctors don't even test for T3 or reverse T3. And what about all the antibodies?
Oh my goodness. And that's a huge red flag. Antibodies is immune system dysfunction.
That's
and
right.
It just so happens that Hashimoto's, which is an autoimmune condition where your immune system attacks your thyroid gland, Hashimoto's is the number one cause of hypothyroidism in the United States. And the traditional approach is, it doesn't matter, just check the thyroid hormone, because you can give them thyroid hormone. If too much thyroid gland gets destroyed, then they then go on Synthroid or levothyroxine. But the issue is, if you have immune system dysfunction, that's important. If your immune system is attacking body parts, that's a big deal. And it can turn into other forms of autoimmunity if you don't address why the immune system is malfunctioning in the first place.
Why is it attacking? That brings up a really good point. We talk about autoimmunity, and 85% of autoimmune diseases are women.
Yes.
Why is that, Yvonne? And what is it that we can do to help women to not have that high percentage? In other words, not have autoimmunity, so give us your thoughts about women and autoimmune diseases.
This is dabbling now into Chinese medicine. And it sounds a little woo-woo, but it just makes so much sense to me when I heard it explained this way, that there's implosion, where you fold in and implode on yourself, and then there's explosion, which is like rage and explosion. Like a heart attack is explosion. Autoimmunity is implosion. Your body's attacking itself. Your body's trying to commit suicide. So why, I think for women, the reason we get it more is because we don't take care of ourselves. We care for everybody else. We're always giving. We're afraid to put ourselves first. And so with that depletion over and over and over again, that leads to the illness that is the implosion illness.
And is there a psychological element to this? Or obviously we know there's a toxicity element. I mean,
absolutely.
Everybody is exposed. Yeah,
absolutely.
So go ahead.
Almost everyone who has autoimmunity has some significant history of trauma in their life.
Exactly.
And if you don't ask it as a doctor, people aren't going to divulge it. And we can't change the past, but we can certainly get control of the nervous system, because trauma is an issue of lack of nervous system regulation. Your body gets trapped in the fight or flight emergency mode because of unresolved trauma. It's stored in your body. There's so much data on that now. And if you do not know how to go in there, get it released and regulate the nervous system. God made us to live our lives in the parasympathetic relaxed mode. But when we are a history of trauma, or we're too busy and we're super high stressed, we're living 24/7 in the sympathetic mode. And that is a setup for cancer and autoimmunity and any other disease.
And I asked my functional medicine doctor, why can't we just test cortisol? She said, no, it's very difficult to measure cortisol just in the blood.
Yeah,
in the morning.
Very.
She said, in the morning, your cortisol is always going to be lower because you just awakened, but later in the day, and so it really
There's
is
actually
cortisol.
a cortisol curve. It climbs a mountain. So it's low when you first wake up, then it goes high, and then it goes down again, and it's supposed to be lowest
as you get closer.
And it's a pretty big range. So just checking one hormone level throughout the day doesn't tell you if your curve is normal. And it's not practical to get your blood drawn 4 times in one day to know your blood hormone. So we'll check saliva or urine in multiple samples throughout a day and get a good picture of the cortisol curve. The other issue is, even me as a doctor, if somebody's coming at me with a needle, my cortisol goes up a little bit, because you're like, I hope they know what they're doing. Last time I got a bruise, I hope they get me on the first stick, so that little bit of anxiety about here comes someone with 5 tubes of blood, 5 tubes and a
Right.
needle, that's going to be enough to spike your cortisol a little bit. So blood
That's
is not
right.
a very good indicator.
But so okay. So is there a point in life where it's too late for HRT?
What a great question. And that's the $1 million question. The studies way back found that women got the most benefit if they started, the earlier they started in menopause, the better. Even in the transition before they're fully menopausal, the most benefit is the earlier you start. But then you look at like, does that mean you get zero benefit later? Just because you don't get the most benefit, I'm not going to withhold that if I know that other things are on board. Now, the older we are, the more likely we have rusty locks, right? Because we've lived longer and abused our bodies a little bit longer and breathed in more toxins longer. And so we need to make sure we have that. And then we do want to do a cardiovascular evaluation to make sure that someone's not at super high risk for heart disease. Because one of the things is with hormone replacement therapy, with estrogen, it increases the elasticity of the blood vessels, and the theoretical risk is if someone has a plaque there, and now all of a sudden you make it more trampoline-like, it could dislodge the plaque and lead to a heart attack. But I think that's more of a theoretical risk, and since we're not talking about oral estrogen, we're talking about transdermal. But I still will do a cardiovascular evaluation, advanced lipid testing on someone, and make sure that they don't have massive cardiovascular inflammation before I start them on hormone replacement therapy if they're outside the 10-year window.
Well, any good functional medicine doctor is going to want a baseline.
Yeah.
Baseline.
The number one killer of women is heart disease, and the first symptom of heart disease is a heart attack.
That's right.
So we don't want to optimize your hormones and have you walk out the door and have a heart attack because nobody checked, not because the hormones caused it, but we want to be able to intervene on anything we can to improve your quality of your health span.
So do you have any secret formula for measuring the body's toxic load? Like if a let's just use the example of the woman that's coming into you and saying, no matter what I do, I don't lose weight, or I always feel lethargic, or I don't have a libido anymore. The usual complaints that you hear. And yet, their hormones allegedly are normal. So, obviously we have this whole body approach to medicine to health. So how do you deal with getting the toxic load understood by the patient, and then addressed with an action plan that will make a difference and detoxify to the point where those signaling molecules, the hormones, are now going to have far more impact?
With my patients, our first visit is over an hour, and I think you really need to know someone's story, and that's what I do for the whole first visit is I listen to their story. Did they live near farmland? Did they live in a city? Were they sick growing up? Did their parents smoke? All of those things are suggestive of a higher toxic load. Did they get an illness young in life that makes me think that they have a high toxic burden? So I listen to those things. I know we all have toxins, and so for a lot of my patients, we just do a toxin reduction strategy where we get rid of as many ongoing exposures as we can, and then we gently, safely, at the pace the body can handle, start removing the toxins. And that's what we work on our patients with when we take them into the practice, is to make sure that we're getting rid of stored up toxins that have accumulated over the years. But if there's a story that's a significant illness that I know, or they have a significant exposure, they lived in a moldy house for 10 years and they've had allergies and brain fog since, then I will sometimes order toxicity testing, and those are functional medicine labs, and there's different ones available. Most of them are urine tests. We can check for mycotoxins, which is exposure to mold. We can test for chemicals, which are industrial chemicals. And then there's heavy metal testing. Mercury, arsenic, cadmium, lead, aluminum are the big ones. And so there are functional medicine tests that we can do to assess the body burden. And I will reserve those for people who have a story that makes me suspicious that they're going to be significantly high and we want to follow those levels down. We all have them and we might all benefit from the testing, but I try to be cost conscientious because those tests are not covered by insurance. And if I think that I can act and get someone feeling really good, then I do the action without knowing those levels initially, because probably 75% of my patients feel so much better going through the program and the protocols that they don't need to do the toxicity testing in the end. Yes, I have a YouTube channel. It's at Yvonne Karney MD. I'm also on Instagram. I have a brick and mortar functional medicine practice in the Chicago suburbs. Anybody in the area, we would love to be able to help you. I have a fabulous team here. And I also want to mention that we have a hormone quiz on our website, and I'd be happy to give you the link to that here. And it's a great quiz that you can take to evaluate, do you have hormone imbalance symptoms? And if you're wondering, do I have rusty locks, because I've been talking about the importance of the cell, if you've got 4 or more different hormone imbalances, chances are it's rusty locks and not just hormone problems. So if you take my quiz, then we can work with you afterwards in the form of some emails to give you some advice on what you can do to help balance your hormones and get rid of rusty locks.
Unfortunately, we lost our power here in Tiburon, California, and I had to let Dr. Karney finish answering the question I had asked her, and I understand from the follow-up that she did do that. So I just wanted to say thank you so much for Dr. Karney for being so informative, and I hope this was really helpful to a lot of the women that are viewing my podcast. So I know it was helpful to me to hear her viewpoints on all these subjects that relate to our hormone health. So I just want to wish everybody a wonderful day, and we'll be back soon. Take care. Bye-bye.